Welcome, and thank you for choosing UCLA Medical Center Santa Monica. In alliance with the Orthopaedic Institute for Children, we strive for continuous excellence to achieve leading-edge patient care, research, and education. Our hope is that this video will help answer any questions you may have about what to expect before, during, and after your hospital stay.
Preparations for your hospital visit begin before you come to UCLA Medical Center Santa Monica. If you have not been contacted by our Pre-Operative Evaluation Center, also known as PEC, please call us at 310-319-4742 between 9 a.m. and 5 p.m. one business day before the surgery. A registered nurse will tell you the time to report to the admissions office for your child's surgery and answer any questions you may have. If your child develops a cold, fever, or rash, please call the surgeon's office. The surgery may need to be postponed. If you speak little or no English, we offer interpreter services at no cost to you. Please notify our PEC staff the day before the surgery. Surgery and hospitalization can be a stressful time for children and their parents. Fortunately, our child life specialists are committed to improving the hospital experience for you and your child with developmentally appropriate education and preparation about all aspects of their hospital stay. The Child Life team is available for pre-admission and pre-surgical tours for the hospital and to answer any questions you may have. Information about the CHASE Child Life program and how to prepare your child for hospitalization can be found on our website, uclahealth.org/childlife. If you feel you need any additional help, please contact our Child Life office at 424-259-8219. Depending on your child's age and type of surgery, what they can and cannot eat or drink before the procedure will vary. Please discuss your child's specific fasting guidelines with the PEC nurse the day before you come to the hospital. All patients should take a shower and wash their hair the night before surgery. If their surgeon has given them special wipes or soap, follow the doctor's instructions for use. Please do not bring any medications from home unless specifically instructed to do so. Before your arrival, however, please continue to give your child's medications as prescribed unless your child's physician provides other instructions. Remember to only have a small sip of water with medications. Ask your doctor if you should bring any medical records to the hospital, including any test results or MRI, X-ray, or CT scans. On the day of surgery, you will be asked to sign the consent for procedure or surgery and consent for anesthesia. Children and minors under 18 years of age must have a parent or legal guardian available to sign the consents. If you are not the parent or legal guardian, please bring identification and current documentation that shows you are able to provide consent. UCLA Medical Center Santa Monica is located at 1250 16th Street. It is half a block south of Wilshire Boulevard. From Wilshire Boulevard, head south on 16th Street, and the hospital will be on your immediate right. Valet parking is available at our main entrance. For other parking options, please visit our website, uclahealth.org. Please only bring essential personal items and leave any overnight luggage in your car. It can be brought up to your child's room after your surgery. Upon arriving, enter through our main entrance and walk straight ahead. Make a right at the end, and admissions will be on your right-hand side in room G314. You will then be directed to our surgical waiting room in room 3500 on the 3rd floor. Your child will prepare for the procedure in the Procedure Treatment Unit, also known as PTU. They will change into a hospital gown and their vitals will be constantly monitored with a blood pressure cuff and a pulse oximeter, which slips on their finger to measure their oxygen levels. If you will be waiting in the hospital during your child's surgery, you will receive a pager to keep you informed of any updates and the status of your child's surgery. Please note that the pager has a radius of only 1 mile. You must stay nearby for the pager to work. They'll have the opportunity to meet their doctors and have any questions answered. The anesthesiologist will begin an IV so that sleep medication can be given. This could be a time of anxiety for the child, but you can help reassure them by saying that any discomfort will go away very quickly. Let them know that the IV will make sure they sleep during the surgery and feel nothing. A child life specialist can be on hand to help prepare your child, explaining what's about to happen in ways the child can understand. They can also bring games and toys to help put your child at ease. When it is time for surgery, your child will be taken to the operating room. In the OR, monitors will be placed to continually check your child's well-being. Your child will also wake up with this monitoring equipment in the recovery room. Anesthesia is given in the OR to ensure that your child is completely asleep and comfortable throughout the surgery. Following the procedure, your child will recover in our post-anesthesia care unit, also known as PACU. Visitors are permitted on a limited basis. Please contact your nurse for more information. It is common for children to wake up from anesthesia irritable and disoriented. A familiar item from home and physical comfort could help your child feel safe and better. After 1 or 2 hours, your child will usually feel more awake and alert, but recovery time will vary by patient. Depending on the surgery, your child may wake up with a cast or brace. The nurses and therapists will answer any questions you have about it. If your child will be admitted to the hospital following surgery, he or she will be transferred to our pediatric inpatient unit. We encourage your child to pack a small overnight bag with familiar objects and favorite activities from home. For a scoliosis-related back surgery, you can expect to be in the hospital approximately 4 to 6 days. For hip and other leg surgeries, you can expect to be in the hospital approximately 1 to 3 days. Each patient room has a place for one parent or caregiver to sleep for overnight stays. Parents and families are welcome to visit during hospital admission. All visitors will need to check in and get a visitor's pass at the entrance to the pediatric unit. We do ask that no visitors under 18 years of age spend the night for safety reasons. Pediatrics has 25 private rooms, each with its own bathroom, sink, and closet. There's also a supervised playroom. Your care team will consist of many people. Your child will be assigned a registered nurse and clinical care partner each shift. Your child will also likely be visited by a pediatric social worker, case manager, physical therapist, and a child life specialist. All of our staff members will be wearing an ID badge. Please don't hesitate to ask anyone who enters your room who they are and what their role is. One of your primary team members will orient your child to the amenities in the room and review our safety guidelines. Each room has a communication board that is updated daily with the names of members of your child's healthcare team. During daily staff shift handoffs, a bedside report will be done in your presence. This is a good opportunity to ask your nurses questions and get involved. Once your child is allowed to eat, he or she will be able to order meals from our room service menu according to the diet recommended by the doctor. If your child needs to use the bathroom, use the call light to ask for help. We do not want your child to get up without assistance. It may be helpful to simply use the bedpan or bedside commode immediately following surgery. Our team places great importance on infection prevention. It is our practice to clean hands before and after all patient contact in order to protect our patients and ourselves. After your child's surgery, we will focus on pain management, deep breathing, food, fluids, and elimination, mobility and safety, and infection prevention. After surgery, it is expected that your child may experience some pain. It's important that their pain is kept at a tolerable level so they can successfully and comfortably progress through healing. Their surgeon and nurse will review options for pain control. Other age-appropriate alternative pain management techniques such as distraction, play, and pet therapy are also available. When pain is controlled, your child will sleep better, move better, and ultimately feel better. We ask that you take an active role in their pain management and communicate your child's needs to us. Deep breathing and coughing are important to do after surgery to help exercise the lungs. Good nutrition is important in the healing process. After surgery, your child may feel very hungry or not feel like eating at all. To keep hydrated, your child will come out of surgery with an IV until he or she is able to take in fluids and food without any problems. The pain medications could make them constipated. Therefore, it is important for them to drink fluids, eat fiber-rich foods, and walk around. After surgery, we do all we can to prevent infection. Your child might be given antibiotics for a short time. Remember to clean your hands and their hands frequently while you are in the hospital. Your child may be evaluated by a physical therapist or PT on the first day after surgery. The PT will assess how well your child is able to move around in bed, stand up, and walk as tolerated. Your child will be seen by the physical therapy staff every day while they are in the hospital or until their physical therapy goals are met. They will be instructed in basic exercises and, as applicable, the PT will assist them in properly putting on and taking off their brace. The PT staff will help progress their general mobility and prepare them for discharge home. This will include techniques for getting out of bed, improving walking tolerance, and curb stair training. An assistive device, such as a walker, may be recommended for safety while out of bed. Our case manager will assist in getting any necessary equipment for your child to use at home, in the car, or at school. Before being discharged, we expect that your child will be taking oral pain medication to bring pain to a tolerable level or better, and that they will be eating and drinking without restriction. Please arrange in advance for transportation from the hospital. Be assured that you will leave with all the information you and your child need to ensure a smooth transition to home. Remember, if you have any questions at any time, please call us at 424-259-9620.
Thank you for watching this video. We want to assure you that your child will be cared for by some of the best orthopedic surgeons, nurses, and healthcare professionals in the world, who will make sure you have a great experience at UCLA. We look forward to taking care of your family.